All right, let's take you here now. The South African Health Products Regulatory Authority has confirmed a second death of Guillain-Barre syndrome following the Johnson & Johnson vaccine. Now, in a statement released on Monday, SAHPRA says a causality assessment of the cause of the case was conducted by the National Immunisation Safety Expert Committee. The death was classified as being related to the J&J vaccine. The regulator has urged the public to continue reporting severe adverse illness after vaccinations. Now, let's get more analysis and just discuss this a little bit further. We're now joined via Zoom by the Deputy Minister of Health, Dr. Sibongiseni Dhlomo. Dr. Dhlomo, thank you so much for your time this afternoon. Let's first get your reaction to this second death following the Johnson & Johnson vaccine. I'm sure you can imagine the concern across the country at these news.
Yes. No, when we actually, thank you very much, and good afternoon, Unati, and your viewers. When we started the program of vaccination, and there were some structures that were set up, amongst others, the Ministerial Advisory Committee, and this one that is also looking into the aspects of what to do when you actually get side adverse events, you would actually get a scientific view that indicates to us what is your expectation of that. Now, I just wanted to report to you, Unati, that to date we have just over 9 million doses of a J&J that have been given to our population. And this is a second Guillain-Barre sort of case. There will then be an expectation from what they have advised us that you get such an incident. It's very, very rare, 1 in 1 million. So you probably are saying, yes, it is a very big loss for that family, for that community. There is this that you would expect in 1 million of people vaccinated to get at least one who could be affected by this condition.
Dr. Dhlomo, while you're giving us those stats about the people who have been, receiving vaccines, just give us a total number of South Africans who have been vaccinated to date. And I know that at the beginning of your vaccine drive, you were aiming at least 70% of the country.
Thanks, Unati. We just have about over 20.5 million South Africans who have now been vaccinated. That excludes 2.6 million of the children between age 12 and 17. So all in all, it's just about close to 23 million vaccinated South Africans, including the children from 12 to age 17 to date. There is a very slow progress now.
No, continue, Dr. Dhlomo.
South Africans are not coming in as big numbers as we had planned, but we have kept the vaccination program of COVID-19 within the whole framework of the health services that we do provide. It should just be taken like when every mother has delivered a baby, we urge them and they do take a BCG vaccine for the little ones, because we now have established in the country, as we are sitting here in the TB conference in Durban, that the TB is very endemic in our country. Therefore, you must be vaccinated against it. We have not received any information that we are out of the woods with in terms of COVID-19. At most, we are probably on the endemic side of vaccine of COVID-19. So we'll still urge South Africans to do get a dose of a vaccine, because we are in the midst of that. May as well be slow numbers now, very low figures, but nobody has indicated to us we might not get another wave. We do have a world that has got COVID-19. Probably it is still safer to vaccinate.
Very low numbers indeed, Dr. Dhlomo. But let's go back now to this incident in terms of this latest death. Just given the concerns around the safety of vaccines that we've been hearing, not only in South Africa, but across the globe, are there any investigations that are currently taking place on any previous deaths of people who have died after being vaccinated, who don't necessarily have this GBS?
Yes, Unati, there is this process. It may or may not be related to any vaccination, but if you do experience post-vaccination, a day, 2, a month, or 3 weeks, any symptoms or any feeling that could actually be described as an adverse event, do report to the nearest clinic, to the nearest hospital, or even to offices of SAHPRA. That will then be taken into a process of investigation. So firstly, it's a report that I have not had this before. I now have this. I probably think it is related to the vaccine. Then there will be a process of investigation that will probably determine and maybe bring a causality link with whatever that you are experiencing. And that will then be taken to a committee, and that will then be taken into a process of a compensation if the serious adverse event is such a nature that it might have caused either death or maybe severe limitation or disability of an individual who has actually been reported or to be suffering from it.
Dr. Dhlomo, we understand another large consignment of vaccines, Pfizer vaccines, will be destroyed in the country next month. You know, given the lack of vaccination by the public, as you've indicated, about 23% of the public has now been, vaccinated. Is this an indictment on the lack of effectiveness of the country's vaccination program, particularly headed by the Department of Health?
I don't know how you come to that conclusion, Unati. It was our excitement and optimism to make sure that every South African should get a jab. Now, that is actually the population of our country is over just 50 million. Not every South African has come forward. It should have been the other way around. If you are saying, Dr. Dhlomo, there are South Africans who are lining up everywhere in the country and we are not having vaccines to give them. Why are you not having vaccines to them? It's the other way around now. We bought enough, we got enough for everybody to actually receive. South Africans, for whatever reasons, have not come forward. Despite all messages, despite all the mobilization that has taken place, despite even the younger healthcare professionals coming forward to say, I am ready, please come and vaccinate. All processes to say we are ready to open recreational facilities, we are ready to support sporting activities, provided you are vaccinated. All sorts of things were done. There are vaccines sitting and nobody's receiving them. So I'm saying, Unati, the other way around, you'd have been having an issue with us to say, why are you not having enough vaccines when South Africans are crying for vaccines? The other way around, we have got enough in stock and we just can't get people to volunteer and to give consent to receive those vaccines.
Dr. Dhlomo, that's all the time we have for this afternoon. Thank you so much for your time.